In the summer of 1961, at an estate sale in rural Kentucky, a wooden cabinet sat beside a dead man's examination table with its doors still closed. Nobody opened it. They loaded it onto a truck with everything else that didn't sell. By nightfall, it was gone. That should have been the end of the story. It wasn't. The doctor had kept that cabinet beside his examination table for 31 years. Not in storage, not on a back shelf. Beside the table, where his hands could reach it without looking. His patients knew what it meant when he turned toward it. Then he died, and the cabinet disappeared with him. Within a generation, what was inside it had vanished from American medicine almost entirely. Not just from one office in Kentucky, from offices across the country, from hospitals, from medical schools, from the rooms where doctors were trained. Gone. Then, 60 years later, the laboratory started publishing. What they found didn't make headlines. It appeared in journals most people never read, in language most people never see. But it was there, quiet, specific, and impossible to ignore once you knew where to look. This is the story of what was inside that cabinet, what happened to it, and why the question nobody thought to ask at an estate sale in Kentucky in 1961 turns out to be one of the most important questions in American medical history. The cabinet held 25 preparations, 25 treatments that trained physicians used on their patients before 1940, that vanished from medical practice, so completely that most doctors alive today have never heard of them. This is what they were. Number 25. Willow bark for pain and fever. Long before aspirin existed in a foil blister pack, physicians reached for the bark of the white willow tree. Reverend Edward Stone documented its effects in a letter to the Royal Society in 1763 after testing it on 50 patients with fever and rheumatic pain. Thomas McLagan published clinical trials using willow-derived salicin for acute rheumatism in 1876. Hippocrates had recommended willow bark centuries before that. The active compound is salicin, which the body converts to salicylic acid, the same mechanism that makes aspirin work. Bayer synthesized acetylsalicylic acid in 1897 and patented it. They could not patent the willow bark, so they marketed the synthetic version as modern and scientific, while the original disappeared. Your great-grandmother's willow bark tea did the same thing aspirin does. It just could not be sold for $1 a tablet. Number 24. Foxglove for heart failure. William Withering published his landmark study in 1785 after observing foxglove's use in folk medicine for dropsy, the fluid accumulation that kills patients with failing hearts. He documented 163 cases over 10 years. By the early 20th century, every cardiac physician understood the digitalis preparation derived from foxglove leaves. The active cardiac glycosides strengthen heart contractions and regulate rhythm. In the 1920s and 1930s, digitalis was the primary treatment for what we now call congestive heart failure. It remains in clinical use today as digoxin. The pharmaceutical version is a purified extraction of what Withering was prescribing from the garden. The plant did not become less effective when the patent arrived. It became less visible. Number 23. Elderberry for influenza. Rural physicians across Appalachia, the Midwest, and the rural South knew elderberry syrup as the standard treatment for influenza throughout the 19th and early 20th centuries. Researchers at the University of Sydney published findings in the Journal of Functional Foods confirming how it works. Compounds from elderberries directly inhibit the influenza virus's entry and replication in human cells by blocking viral proteins responsible for penetrating cell membranes. A meta-analysis of randomized controlled trials found elderberry supplementation substantially reduced upper respiratory symptom duration with an effect size of 1.717, a result most pharmaceutical flu interventions would be proud to claim. The anthocyanidin compounds in the berry's deep purple skin are the active agents. Your great-grandmother's elderberry syrup was the correct treatment, confirmed by the same methods that validate every drug in your medicine cabinet. Number 22. Raw honey for wounds and infection. Every military physician, every frontier doctor, and every farm wife in America before 1940 knew that raw honey applied to a wound prevented infection and accelerated healing. It was standard medical practice. The mechanism has since been documented in full. Honey's low moisture content creates an osmotic environment inhospitable to bacteria. Its naturally occurring hydrogen peroxide provides antimicrobial action. Its acidic pH suppresses the growth of virtually every pathogen that infects open wounds. The FDA cleared medical-grade Manuka honey wound dressings in 2007 and 2010 for clinical use on burns and chronic wounds. Hospitals now use them on surgical sites that have failed to respond to antibiotics. The only difference between what your great-grandmother spread from the kitchen jar and what a hospital applies today is the sterility certification and the price tag. Number 21. Garlic as antimicrobial. Hippocrates prescribed garlic for pulmonary conditions, wounds, and infections. Pliny the Elder documented its use across dozens of ailments in ancient Rome. Every physician tradition from Ayurvedic to European folk medicine to American frontier practice used garlic as a primary antimicrobial agent. The active compound, allicin, formed when raw garlic is crushed, demonstrates antimicrobial, anti-inflammatory, and cardiovascular effects that modern laboratory research has confirmed in detail. A meta-analysis published in 2024 covering 108 randomized controlled trials involving more than 7,000 participants found that garlic supplementation produced significant reductions in both systolic and diastolic blood pressure. A separate 2024 systematic review found that aged garlic extract reduced LDL cholesterol and blood pressure in controlled trials. The antibiotic era made garlic seem primitive. The antibiotic resistance crisis has made researchers look at it again. The plan has not changed. Our opinion of it has. Number 20. Echinacea for immune support. Commercial manufacture of echinacea preparations began in 1938 when the German company Medals introduced echinacin, making it one of the best documented herbal remedies to cross the boundary between traditional and commercial medicine. Physicians across Europe and North America used echinacea for infections and respiratory illness throughout the early 20th century. More than 800 studies have been conducted since the 1930s. Results vary across preparations and species, but no serious researcher disputes the plant produces immunostimulant activity. Your great-grandmother's echinacea tincture with a functional immune modulator whose clinical profile researchers are still mapping with tools she never had. Here is a pattern you will see repeated across every item on this list. The pharmaceutical industry did not make these treatments disappear because it proved they did not work. It made them disappear because they could not be owned. A plant that grows in a field cannot be patented. A synthetic compound that mimics its active molecule can be. The strategy was not to disprove herbal medicine. The strategy was to reclassify it as unscientific, regulate it out of physician practice, and then spend the next 50 years conducting the research that your great-grandmother's doctor already knew by experience. The studies on this list are the evidence that the strategy was never about your health. Number 19. St. John's wort for depression. Physicians in the early 20th century prescribed Hypericum perforatum for what they called melancholy and nervous exhaustion. A systematic review published by the RAND Corporation found that modern randomized controlled trials show St. John's wort is more effective than placebo for mild to moderate depression and produces outcomes comparable to standard antidepressants with fewer side effects. The FDA has not approved it as a drug, regulated as a dietary supplement. The pharmaceutical industry cannot patent it and has every incentive to keep it out of clinical guidelines. The plant is growing on the roadside outside your house. You just were not told. Number 18. Valerian root for sleep and anxiety. Every herbal dispensary before 1940 stocked valerian root as the primary remedy for insomnia and anxiety. During World War I, it was used in Britain to calm civilians during air raids. Modern research confirmed that valerian contains valerianic acid and isovaleric acid, which interact with GABA receptors in the brain, the same receptors targeted by benzodiazepine drugs like Valium. The pharmaceutical industry named their drug after the plant, then spent decades discrediting it. Valerian root has no addiction profile and no withdrawal syndrome. Your great-grandmother's valerian tea addressed the same receptor mechanism that generates billions in pharmaceutical revenue every year. Number 17. Ginger for nausea. Ship physicians, military surgeons, and frontier doctors used ginger root as a standard treatment for nausea through the early 20th century. Ginger ale was sold in pharmacies as a medicinal product through the early 1900s. Modern research confirmed that ginger reduces nausea through its effects on digestive serotonin receptors and anti-inflammatory action on the gastric lining. Multiple trials have shown significant benefit in chemotherapy-induced nausea, and it is now used in clinical oncology alongside standard antiemetics. The pharmacist who sold your great-grandmother ginger root knew it worked. The oncologist using it today has the published trials to prove it. Number 16. Turmeric for inflammation. Turmeric had been used across traditional medicine systems for more than 4,000 years for wounds, joint pain, and fever. The compound curcumin, which gives turmeric its golden color, is now one of the most studied plant compounds in medical literature. Research has documented its inhibition of the NF-κB signaling pathway, a central mechanism in chronic inflammation and a target of numerous pharmaceutical anti-inflammatory drugs. Studies have found it effective against markers of inflammation in conditions from arthritis to metabolic syndrome. The challenge has been bioavailability. Curcumin absorbs poorly alone, a problem traditional medicine solved by combining turmeric with black pepper, which increases absorption by up to 2,000%. Your great-grandmother combined them in her cooking. Researchers explained why in peer-reviewed journals in the 1990s. Number 15. Peppermint for digestive disorders. Peppermint was listed in the United States Pharmacopoeia as a medicinal preparation through the early 20th century. Physicians prescribed it for digestive cramping and what was then called nervous stomach. Modern gastroenterology confirmed the mechanism. Menthol acts as a calcium channel blocker in smooth muscle tissue, relaxing the intestinal wall and reducing spasm. A Cochrane systematic review found that enteric-coated peppermint oil capsules significantly outperformed placebo in treating irritable bowel syndrome, a condition affecting 10 to 15% of American adults. Peppermint oil is now prescribed by gastroenterologists in several European countries. In the United States, it remains classified as a supplement. Your great-grandmother's peppermint tea was a functional antispasmodic with a mechanism that modern pharmacology has since mapped to the molecular level. Number 14. Yarrow for bleeding and wounds. Every soldier's kit bag, every frontier medicine chest, and every home pharmacy before 1940 contained dried yarrow, called soldier's woundwort because military surgeons packed it into wounds to control hemorrhage. The Latin name Achillea millefolium references the myth that Achilles used it on the battlefield. The active compounds achillin and achiltin promote platelet aggregation and blood clotting. Modern wound care research has documented these hemostatic properties and confirmed the plant's anti-inflammatory action through its flavonoid content. The plant is growing in waste ground across every American state. Military field medicine used it for a reason. Laboratory research has now confirmed what reason. Number 13. Plantain as a drawing remedy. Broadleaf plantain. Plantago major, the flat-leaf weed in every American sidewalk crack, was applied to splinters, infected cuts, and insect bites in every household before the pharmaceutical age. Crush a fresh leaf until the juice ran. Press it against a wound, and within minutes inflammation visibly reduced. The active compounds include aucubin, an iridoid glycoside with documented anti-inflammatory and antimicrobial properties, and allantoin, which promotes cell regeneration. Peer-reviewed pharmacological research has confirmed these mechanisms. The plant is in the crack of your driveway right now, working by exactly the mechanism that research has since confirmed. Number 12. Comfort for bone and tissue healing. Physicians called it knit bone, bone set, and bruisewort before 1940. Comfrey root preparations were applied to fractures, sprains, and deep bruising with consistent results. The active compound allantoin promotes cell proliferation and tissue repair in damaged bone and connective tissue. A randomized controlled trial published in Phytomedicine found comfrey root extract applied topically significantly reduced pain and accelerated recovery in ankle sprains compared to diclofenac, a standard pharmaceutical anti-inflammatory. The internal use of comfrey is restricted due to alkaloid content, a legitimate concern. The external preparations physicians used before 1940 have been confirmed effective and are used in European sports medicine today. Here is the second thing nobody told you. The Flexner Report of 1910. funded by the Carnegie and Rockefeller Foundations, both holding significant investments in the emerging pharmaceutical industry, resulted in the closure of the majority of American medical schools teaching botanical medicine. Presented as educational reform, it was also the single most effective piece of regulatory capture in American medical history. Within 2 decades, the physicians who knew these treatments had been trained out of botanical practice. The knowledge did not disappear because it stopped working. It disappeared because a report funded by people with pharmaceutical investments decided it was not medicine. The confirming studies came afterward, quietly, in journals outside pharmaceutical control, by researchers who did not ask permission. Number 11. Golden Seal as antimicrobial. Every eclectic physician and frontier doctor used golden seal root for infections of the throat, sinuses, digestive tract, and urinary system. The active compound berberine has been studied extensively in modern pharmacology. It has demonstrated antimicrobial activity against a broad spectrum of bacteria and fungi. A clinical trial found berberine comparable to metformin in managing blood sugar in type 2 diabetes. Multiple studies documented its effectiveness against Helicobacter pylori, the bacterium responsible for most stomach ulcers. Berberine has become one of the most researched plant compounds in modern pharmacology, with pharmaceutical companies working to develop patentable derivatives. The golden seal root your great-grandmother's physician kept in his dispensary contained the compound they are trying to replicate. Number 10. Milk thistle for liver protection. Pre-1940 physicians used silabomerinum for jaundice, hepatitis, and what they called liver complaints. The active compound silymarin, concentrated in the seed, demonstrates hepatoprotective effects, protecting liver cells from toxins, supporting regeneration, and reducing inflammation. It is used clinically in Europe for mushroom poisoning from Amanita phalloides, where it has demonstrated life-saving efficacy. Research has documented benefit in alcoholic liver disease and non-alcoholic fatty liver disease. The European Medicines Agency has approved milk thistle preparations for liver disorders. Your great-grandmother's physician knew the plant worked on the liver. Modern hepatology has explained precisely why. Number 9. Feverfew for migraines. Medieval physicians called it featherfew and used it consistently for headache and what physicians today would recognize as migraine. A landmark double-blind randomized controlled trial published in The Lancet in 1988 found that feverfew significantly reduced the frequency of migraine attacks compared to placebo. The active compound perphenolide inhibits platelet aggregation and prostaglandin synthesis, 2 mechanisms directly involved in migraine pathophysiology. Feverfew is now included in national clinical guidelines for migraine prevention in several European countries. The physicians who used it before 1940 were not practicing folk medicine. They were practicing what a 1988 Lancet paper would later confirm was the correct treatment. Number 8. Hawthorn for the heart. Physicians throughout the 19th century used hawthorn berry preparations for heart palpitations, irregular heartbeat, and cardiac weakness. Modern cardiovascular research has confirmed multiple mechanisms. Hawthorn extracts inhibit phosphodiesterase, increase coronary blood flow, reduce peripheral vascular resistance, and demonstrate antioxidant activity in cardiac tissue. A systematic review of randomized controlled trials found significant improvement in exercise tolerance and reduced shortness of breath in heart failure patients using hawthorn extract. The compound oligomeric proanthocyanidins in hawthorn are now studied as cardiovascular pharmaceutical targets. The physicians who prescribed hawthorn in 1920 were prescribing a functional cardiac medication. The cardiologists studying it in 2024 are confirming it. Number 7. Mullein for respiratory conditions. Every apothecary in America before 1940 stocked dried mullein leaves for respiratory congestion, bronchitis, and tuberculosis-related cough. The mechanism is now understood. Mullein contains saponins that act as expectorants, loosening mucus in the airways. It also demonstrates anti-inflammatory activity in respiratory tissue and antimicrobial properties against Mycobacterium tuberculosis in laboratory studies. Research published in the Journal of Ethnopharmacology documented its antimicrobial activity with specific reference to traditional use in respiratory infections. The physicians who reached for mullein when a patient could not breathe were using a functional expectorant and antimicrobial, whose mechanisms research has since confirmed. Number 6. Cayenne for pain. Every frontier doctor and herbal practitioner before 1940 used cayenne for joint pain, neuralgia, and topical pain relief. Applied to skin, it produced warmth and then lasting pain reduction. The mechanism is now well understood. Capsaicin binds to TRPV1 receptors in pain-sensing nerve fibers, depleting the nerve of substance P, the neurotransmitter that transmits pain signals to the brain. The FDA has approved capsaicin in multiple topical formulations for osteoarthritis, neuropathic pain, and post-herpetic neuralgia. A high-concentration capsaicin patch is now prescribed for diabetic peripheral neuropathy. The compound your great-grandmother's physician rubbed onto arthritic knees became an FDA-approved pharmaceutical. The only thing that changed was the patent application. Number 5. Artemisia for infection. Sweet wormwood, Artemisia annua, was used in Chinese medicine for more than 2,000 years for what ancient physicians recognized as malarial fever. An ancient text dating to 340 AD described its preparation for intermittent fever. In 1971, researcher Tu Yu isolated artemisinin from the plant after reading that ancient text as part of a Chinese government malaria research initiative. It cured malaria in laboratory animals with 100% efficacy and has since saved millions of lives worldwide. In 2015, Tu Yu was awarded the Nobel Prize in Physiology or Medicine for the discovery. She did not discover a new compound. She rediscovered an ancient one that 2,000 years of observation had already confirmed worked. The Nobel Prize was given for listening to what traditional medicine had been saying for 20 centuries. Number 4. Lobelia for respiratory distress. American eclectic physicians in the 1800s called Lobelia inflata the most important respiratory herb in their practice. They use it for acute asthma attacks, bronchitis, and whooping cough, observing that it relaxed bronchial spasm and opened airways in ways no other available treatment could. The active compound lobeline has since been studied for its effects on nicotinic acetylcholine receptors, the same receptors targeted by nicotine, and investigated as a smoking cessation aid and respiratory treatment. The eclectic physicians who reached for lobelia during an asthma attack were using a functional bronchodilator at a time when no pharmaceutical bronchodilator existed. The mechanism they observed empirically has since been confirmed by researchers who did not give them credit. Number 3. Black cohosh for women's health. Physicians in the late 19th and early 20th centuries used black cohosh root for menstrual cramping, menopausal symptoms, and hormonal irregularities. Native American healers had used it for the same conditions for centuries. Modern research has documented that black cohosh contains compounds binding to estrogen and serotonin receptors, producing measurable effects on hot flashes, sleep disturbance, and mood. A meta-analysis published in Menopause, the Journal of the Menopause Society, found significant reduction in vasomotor symptoms with black cohosh supplementation. The North American Menopause Society has acknowledged the evidence. The physicians who prescribed it before 1940 did not know about estrogen receptors. They knew it worked. Research has since explained why. Number 2. Licorice root for gastric and respiratory conditions. Every pharmacy before 1940 stocked licorice root for gastric ulcers, sore throats, and coughs. The active compound glycyrrhizin has been confirmed to have anti-inflammatory, antiviral, and gastroprotective properties. Carbinoxolone, derived from glycyrrhizic acid, was a standard pharmaceutical treatment for gastric ulcers in the United Kingdom before proton pump inhibitors arrived. In Japan, a glycyrrhizin preparation is a licensed pharmaceutical treatment for chronic hepatitis. The licorice root in your great-grandmother's medicine chest contained the active compound that pharmaceutical companies later patented and sold at 1,000 times the price. And number 1. Apple cider vinegar as antimicrobial and metabolic aid. This is a remedy that appears in every pre-pharmaceutical household record, every frontier pharmacopoeia, and every grandmother's oral tradition across American history. Physicians before 1940 used it for wound cleaning, digestive complaints, and sore throats. Modern research has confirmed its antimicrobial properties. Acetic acid disrupts bacterial biofilm and kills a broad range of pathogens, including E. coli and Staphylococcus aureus. A randomized controlled trial published in Diabetes Care found apple cider vinegar consumed before meals significantly improved insulin sensitivity in insulin-resistant subjects. A systematic review in the Journal of Functional Foods confirmed its glycemic effects across multiple trials. The remedy every generation of Americans before 1940 kept in the kitchen has accumulated a body of modern research that the pharmaceutical industry has no interest in publicizing because it costs $2 a bottle and cannot be patented. Here is what these 25 treatments have in common. Each was used by trained physicians before 1940. Each was displaced not by evidence of failure, but by a regulatory and economic system that rewarded compounds that could be owned and penalized treatments that could not. Each has since been confirmed by the same scientific methods that validate every pharmaceutical drug on the market, and each is still available in your garden, in a health food store, in the crack of your sidewalk, waiting for the generation willing to remember what the generation before us was made to forget. Your great-grandmother's medicine cabinet was not superstition. It was clinical practice built on centuries of observed outcomes, displaced by economics, and confirmed by science that arrived too late to save the physicians who already knew. The question is not whether these treatments work. The question is why you were not told. Share which one surprises you most in the comments, because the answer says everything about how completely the erasure worked and how much there is still left to recover.